So guys, welcome back to another
Sure,
new
sure.
episode of the Synapse.podcast. Today we have Dr. Raj with us. जिनके रील्स आपने हमेशा इंस्टाग्राम पे देखे होंगे. इफ यू आर द पर्सन हु फॉलोज एनी मेडिकल इंस्टाग्राम पेज, you might have seen his reels. And apart from being a med influencer, he also is an intern at Gandhinagar Hospital. So today he's here to give us an experience about how an intern life looks like in India. Because the reason why I'm doing this podcast basically is because I saw one of your reel in which you were talking about insane working hours of doctors, and I knew
Absolutely.
about
Yes.
that, but I haven't given serious thought of what working of 10 hours, 12 hour shift would be like. So that's why I wanted to know an experience of how a person goes through that shift.
Yes.
So डॉक्टर राज बताइए कैसी चल रही है आपकी लाइफ. हाउ इज इंटर्न लाइफ गोइंग आउट राइट नाउ?
Life is going good right now, preparing for a few exams. Doctors, Hamesha, you just need to prepare for exams,
Yeah.
exams. That's the constant always. You just need to keep reading, keep appearing for exams and all of that. So just stuck here in life, you know. You just have to keep reading and all of that. A lot of, like you said, lot of working hours as well. So should we go into that? Should we talk
You can
about
start
that a little
off.
bit more?
Yeah, you can start with.
Okay. Is this live, by the way, or is it going to
No,
be?
no, I am going to make it live in July. So this would come in July.
Okay, okay,
Okay.
okay. So yeah, of course, the working hours. I'll tell you कि मतलब हम लोग जब MBBS लेते हैं, when we write NEET UG, you know, we are all naive कि अच्छा ठीक है, पढ़ना ही तो है, पढ़ लेंगे. We'll just give the exam and college में मतलब acceptance हो जाएगा. We'll just read. We'll just do 5.5 years of studying, and it's all respect and it's all green on the other side. But the thing is कि हमें कोई बताता नहीं है कि मतलब उसके बाद पढ़ाई के बाद लाइफ कैसे होने वाली है.
Yeah.
And that is the biggest disclaimer, I think. Your NEET examination या जो भी career counseling, I don't know, इंडिया में career counseling नाम की कोई चीज ही नहीं होती. First of all, मम्मी पापा बताए थे हाँ इंजीनियरिंग लो, डॉक्टरी लो, हम एग्जाम के लिए प्रिपेयर होते हैं, एंड दैट्स हाउ इट गोज. बट so the biggest disclaimer that should come with a life in medicine or a life as a doctor should be insane amount of workload that you're going to face. It's literally insane. I had no idea. ठीक है, जो फाइनल ईयर तक जो मैं पढ़ाई किया था, I had no idea how my life is going to be like after that, like during my internship or after when you actually have a job. Nobody, like not even my seniors told. Seniors का क्या है, मतलब वो लोग after they cross out, they are busy with their lives. ठीक है, they also have to get married. They have their own life ahead of them. They have to have a job, support their own families. So after one person is like outside the system, they just go on with their lives. They don't interact much with the previous alumni or anything, and nobody really talks about how many hours you have to give this work. Of course, interns work the most. Interns and first year PGs work the most. So it's incredible the amount of work that you have to do even after studying for so long. It's just incredible, really.
Like I was just thinking about this only क्योंकि till now our fourth year, like in our final year also, our life is like कि यार पढ़ाई ज़्यादा. Only the main thing is कि पढ़ाई करनी है हमको, and there isn't many responsibility which is on upon us, or we aren't really answerable to any other person. But I was just thinking about your life कि यार वहाँ पे आप इस पोजीशन में आप आ गए हो जहाँ पे आपको हर रोज जॉब में जाना. काइंड ऑफ जॉब ही है ये बेसिकली. तो जॉब ही जॉब ही है, और आप कहीं ना कहीं किसी को आंसरेबल हो, कि आपकी कोई रिस्पॉन्सिबिलिटीज है, वो सारी चीज़ें. सो like elaborate about how's the basic things what interns have to do in India, because we have seen I've heard quite a lot of stories of interns who have just said कि बेसिक काम उनका यही रहता है कि उनसे केस हिस्ट्री भराई जाती है, फॉर्म फिलअप्स कराए जाते हैं. सो इज इट दैट रियलिटी, और कितना सच है ये बताओ.
If that was the reality, it would be an easy thing, you know, just taking the case and थोड़ा forms fill up करके चलो घर काम हो गया, चलो घर को जाते हैं. But first of all, the situation varies whether you are in a private institute or whether you are in a government institute. First of all, क्योंकि at a government institute you have an immense amount of patients that come in because it's free treatment, right? And government setup mein people get treated free of cost, and there are a lot of patients that you have to that come in to the hospital every day, and so the workload is more in a government setup than a private setup. I wouldn't know how it is in a private setup because I have not experienced a private setup yet. But government setup में जो होता है, there's a lot of workload, and it's not just अच्छा ठीक है, you patients come in, you have to first of all stabilize them like in a casualty emergency department. You have to stabilize those patients, you have to take their histories, and then you have to communicate with the specialist, like with the internal medicine specialist or with the general surgery specialist or orthopedic specialist. Like you have to assess the patient and you have to communicate with those specialists about them, and that is the initial amount of work that you are doing, and sometimes specialists are busy, so you only have to take care of all of the things. And not only is it case history and all of those, you also have to be doing the job of your sisters and nurses. Basically, you have to give all the medications to the patients yourselves. Okay, you have to, if you're in the surgical department, you have to change everyone's dressing yourself, which generally does not happen in a private setup. You have different individuals for different kinds of things, right? But in a government setup, there is the workforce is basically interns. Interns handle everything, all your treatments, all your medications, everything is handled by. कभी कभी क्या करना होता है, you have to literally take a patient from the 8th floor to the ground floor for X-rays and CTs. Okay. It's manual labor, really. It's manual labor more than it is an intellectual labor. You know, of course, intellectuality is there. You have studied for so long and you're taking care of a patient. But the initial years, like internship and first year PGs, they do a lot of manual labor. And the thing here is, in India, there is no fixed work hours. ठीक है, government ने कुछ fixed work hours इसके ऊपर तुम नहीं जा सकते बोले किसी को. They have not given anything, and that is why it's like abusive. Literally, it is abusive. The amount of amount of hours you have to put in. You end up being a good doctor, yes, as a result of this. So that is the good part of the training that you are receiving. But you have to give it an immense amount of time.
Okay. So
that is the
apart
reality.
from all of the department that you might have been through, which was the most hectic one which you had been, and also just
Hectic one is casualty,
Okay,
emergency department.
obvious.
So what happens in emergency departments? What we used to have is around 12-hour shifts. So morning 8 to evening 8. Okay, or like for a few weeks, morning 8 to evening 8, and then the next few weeks, night 8 o'clock to morning 8 o'clock. Those were the timings for the casualty. This thing.
Okay.
For the emergency department postings that we had. Every college has a different set of timings, different set of rules. But
Yours is
this
a
is what we
government
had.
one, na?
It's a government one. It's a Gandhi Medical College and Hospital in Hyderabad.
Okay, so you're in Hyderabad. I thought you were in Gujarat.
Yeah.
Sorry for that. Okay, so what's the most casual, like a most freest department that you might have seen? Like many people say it's PSM department. PSMs.
Radiology.
Okay.
Yeah, radiology. Because the thing is, government setup bhi ho, radiologists always have, an air condition in their room, and they'll always. It's not a lot of manual labor like the other departments have. You just sit and write reports, right? And you assess the patient and you see what kind of problems they have. It's just you are doing it in one place. You have all the equipment in front of you. You're not prescribing treatments or anything, but you're like assessing the patient. You're imaging the patient and all of that. So it was less hectic.
Okay. So one of the things, like एक basic confusion मेरे दिमाग में है, like how much of an Indian medical graduate, like let's suppose you graduated out of after final year you are, so how much of you knew your practical work, कितना तुम practical work पहले जानते थे in your final year before the wards postings that you have as compared to the internship life? Because it's very important to know for us, क्योंकि हम FMGs को बहुत एक बात ये चीज़ हमेशा बोली जाती है कि Indian medical graduates are kind of have much more practical exposure towards the patient compared to us. So that's what I want to know, कि कितना आपको सूचरिंग करना आता था, कि आपको आईवी लाइन सिक्योर करना, ये सब चीज़ आपने पहली बार वहाँ करी इंटर्नशिप में करी, या फिर You did it in ward postings also.
Frankly speaking, ward postings में you do nothing. Okay, 9 to 12 जो रहता है ward postings, even you must be having 9 to 12 only.
Yeah, like we
शायद.
actually have different over here because in the final year we have similar ward postings like in India, but till the final year, like till 5th year, we have like normal classes of surgery. We go to the department and we are posted up with the doctor and we get to see patients with them. Or sometimes he just gives us some task or some case history and we have to write upon that. So that is the basic thing. In final year, we are gonna get the basic ward postings kind of thing.
Like even we had the same thing. Like पहले till our final year, we are just going to postings, we are just observing, right? You're not doing anything. ठीक है. The thing is, even for us, it was the same thing. In fact, I think you must be better trained in the fact that abroad में वो क्या बोलते हैं, there are so many things that people train through models and stuff,
Yeah.
right? You must have trained already to
वो चीज़
intubate and
में,
all of that.
yeah.
Government setup में ये मिलता ही नहीं है. You don't have a mannequin to practice intubation or suturing on. ऐसा situation ही नहीं है. मतलब we don't have those equipment. In fact, you must be better trained in that sense of way. But the thing is, it all changes. The real life patient is completely different from the mannequin, right? And the set of challenges that comes with a real life patient, in a real life scenario where actual emotions are involved, where actual जो बातचीत करना पड़ता है patients के साथ, you have to set up a rapport, that is completely different. But as soon as you come to real life, do internship, maximum 3 से 4 दिन लगेंगे ये सब सीखने के लिए, and then you're just like doing it again and again and again after that. So it is not a big because I in my hospital also a lot of FMGs come in after writing the exam. ठीक है, because you are supposed to do some internship here also, I guess. So and after that and some of them work better than me, in fact. So there is no such barrier ki only we can we learn more or anything like that. We are in the same scenario, same situation, doing the same things. In fact, in some senses you might be doing even better. So it is individualistic कि मतलब कौन कितना अच्छा कर सकता है.
Okay.
It's not like कितना अच्छा पढ़े हो, क्योंकि पढ़ाई and real life is completely different. There is so much of difference in those scenarios.
I also think the same because practical it's whole different thing. जो आपने पढ़ी है book में बहुत सारी चीजें
Completely.
just real life में वो चीज होती नहीं है. ठीक है.
होती नहीं है. Yes.
So how was your first experiences of doing all this? And एक मैंने आपकी फोटो देखी थी, your first baby delivered वाली. So
yeah, that was awesome.
Explain us through that experience, like कैसा था वो?
So what happens is internship में if you ask you get, ठीक है. If you want to perform a delivery, then you have to ask your seniors, you have to ask the specialists, can I also learn बोल के. कोई आके ऐसा नहीं बोलेगा कि अच्छा ठीक है आज मैं तुम्हें सिखाऊंगा. ठीक है. It's all like I'm saying, individual experience and individual curiosity and individual learning curve basically. So कोई आके ऐसा बोलता नहीं है कि मतलब आज तुम्हें ये सिखाऊंगा. As soon as you're an intern, you're basically doing a job, right?
Yeah.
Your studying part is over. जो लोग आके तुम्हें पढ़ाते थे क्लास में, अच्छा आज we'll learn about this specific thing. हो गया वो सब, that is all behind you. As soon as you're an intern, you're in a working setup. So you are going and you are going to work there. If you want to learn something, you have to ask your seniors or the specialists that are there. So what I did was I just went and asked because I knew some of my friends. उन लोगों को opportunity मिली थी delivery करने का, normal vaginal delivery. So I asked my senior as well, ma'am, आज सीखना है मेरे को भी. So let me also get an opportunity to perform this procedure बोल के. And the first time I'm doing it, right? The first time I'm trying a vaginal delivery, and ma'am is in front of me. And she is explaining me how to do it. She is not touching the patient. Okay. The entire thing is being done by me. And for the first time, no help. Only, help in the sort of, like, she's just telling me what to do. Okay. She is not interfering in what I'm doing. She's just telling me what to do. And it went well. I mean, it's a normal vaginal delivery. It's not like a cesarean or anything. But it went pretty well. And baby is delivered. It was a very nice moment for me. It was something that was more interesting than doing normal cut work, paper fill करना, ये करना, patient को X-ray तक लेके जाना. It's definitely better and more interesting than doing that. So that was a really nice moment for me. I have pictures of it on my Instagram. That's why. Yeah.
So now like basic overview हमको पता चल गया what an interview like basic life looks like an internship. But what are the pays? मुझे पता है pays. Stipend कितनी मिलती है?
Yeah. You know, for some reason मैंने एक reel डाला था, ठीक है? This is how much interns get. Nobody seems to believe each other, ठीक है? ये medical community में इतना ego रहता है ना. If I say something, the other person will, out of his ego, will be like, नहीं ये correct नहीं है, without even trying to verify the fact, is it actually correct? I am in a government setup, and in a government setup, the pays are much higher than a private setup. In certain private institutes, you don't get paid at all. Okay, certain institutes you don't get paid at all. So Gandhi mein they pay 22,500 per month for internship. For FMGs there is no pay. If FMGs are coming, there is no pay. But for people who have read in Gandhi, it is 22,500. Now they have hiked the pay to 25,000, which is excellent. 3,000 ही है, पता है. And you are still all of your life. It is something. It is something. Better than 22,000. So that is what it is here. Even in AIMS, I think it is around 25,000 to 30,000. जितना मैंने सुना है, I don't know specifically how much it is there. AIMS faculty has to come in and verify those numbers. But here it is around that much. If you're in a government institute, 25,000 मिलेगा तुम्हें कैसे भी.
Like I can tell you about FMGs. ये चीज़ NMC has made it very clear that we NMC मतलब FMGs को भी pay करना है आपको stipend. But still it's basically depends on the state departments, जो state medical councils होती है उनके में वो इतने.
It is very wrong ना, don't you think कि मतलब तुमसे एग्जाम भी लिखाऊंगा, तुम्हें एग्जाम के लिए पढ़ना भी पड़ेगा, तुम्हें स्ट्रगल भी करना पड़ेगा, and you have to give us free work also 2 साल के लिए. I think
अभी
I'm like what nonsense.
This time it has become 2 years because of our online classes and like I don't know. Tell me literally how much of online classes have Indian medical graduates done till now? Like और उसके लिए कोई आपने वो किया था like to compensate that missed out classes or online classes? Have you done any offline classes?
Online classes were literally a joke. To be honest, normal classes भी really it's like a joke for us.
Online classes आपको
खुद ही पढ़ना पड़ता है. Online classes हुए थे थोड़े. It was not very regular. कभी हफ्ते में 2 बार.
It was like how much of a term till online classes have you attended? Like 6 months कितना attend किया था आपने कोविड के पीरियड में?
नहीं, थर्ड ईयर पूरा हम लोग का ऑनलाइन ही था.
So
थर्ड ईयर एक क्लास को नहीं गए, एक पोस्टिंग को नहीं गए हम लोग.
So उसके अलावा आपने कोई एक्स्ट्रा क्लासेस अटेंड करी कि आपने थर्ड ईयर ऑनलाइन किया तो उसके लिए मैं और ऑफलाइन क्लासेस या पोस्टिंग?
नहीं, हम लोग को ऐसा नहीं. ऐसा कोई.
अब सेम चीज हमारे साथ हुई कि अराउंड एन ईयर हम लोग भी ऑनलाइन गए हैं, ठीक है, ऑनलाइन अटेंड करिए. नाउ द इंडियन गवर्नमेंट सेज कि इंडियन मेडिकल ग्रेजुएट्स ने उसके कंपनसेट करने के लिए ऑफलाइन क्लासेस अटेंड करी है. सो यू हैव टू गो ऑल्सो टू बैक टू योर यूनिवर्सिटी एंड डू एक्स्ट्रा क्लासेस for the amount of hours that you might have lost due to online classes. So that has the rule made it. अगर आपने नहीं किया, अगर ये रूल फॉलो नहीं किया, so आपको 2 साल की इंटर्नशिप करनी पड़ेगी. एंड ऑटोमेटिकली सारे, अब कोई प्रूफ तो नहीं कर सकता कि ऑफलाइन क्लासेस करा है या मैंने नहीं किया बाद में जाके. नॉर्मल 6 years का टर्म रहेगा, वो रहेगा. अब वो उसके बेसिस पे सारे ही बच्चों को 2 years की इंटर्नशिप करनी है. एंड दैट हैज द रूल. और 2 years की इंटर्नशिप
I'll tell you कि मतलब ये जो फील्ड
क्या हुआ?
Yeah, so the thing is ये फील्ड में I'll tell you what is the worst thing about this field MBBS or being a doctor. ठीक है, everybody has so much of ego. ठीक है ना. I don't know who is managing NMC जो भी मैनेज कर रहा है, I think they are like older people, right? थोड़े सीनियर हो गए हम लोगों से. And the mentality is that अच्छा ठीक है, एवरीथिंग इज डिफरेंट. AI आ गया है, मशीन्स आ गए हैं, देयर आर वेज टू रिड्यूस लेबर वर्क. ठीक है, देयर आर वेज टू reduce the time taken to study and all of that, ठीक है. But the mentality amongst the senior citizens or the seniors in this field are that हमने भी ऐसा किया था इसलिए तुम्हें भी ऐसा करना पड़ेगा, ठीक है. इट्स नॉट लाइक अच्छा हम लोग टेक्नोलॉजिकली इतना एडवांस आ गए हैं, वी कैन एक्चुअली गिव लेस बर्डन टू द न्यूअर जनरेशन, ठीक है. नहीं, हमने ऐसा किया था, तुम्हें डबल करना पड़ेगा, यू हैव टू मैच अप टू द सेम काइंड ऑफ नॉनसेंस. सो इट इज रियली फाइट ऑफ ईगोज, ठीक है. इंडिया में स्पेसिफिकली सबसे ज्यादा है. आई डोंट नो इफ इट इज ओनली दिस फील्ड, बट आई हैव एक्सपीरियंस्ड इन दिस फील्ड. That's why I'm telling it that ये फील्ड में होता है, but it is definitely कि मतलब ego issues बहुत ज्यादा play होते हैं इंडिया में specifically.
Yeah. इसमें वीडियो लैग हो रहा है मेरा वीडियो?
So, a little bit, हाँ थोड़ा लैग हो रहा है.
Okay, let it be, it would get correct. बस वो वाली वीडियो स्टार्ट चलते रहने देना, ठीक है. ओके
हाँ, it's working.
ओके. सो ये जो मैं बता रहा था भाई FMGs के बारे में, सो ये इसलिए हम लोग को सबको 2 years की इंटर्नशिप करनी पड़ रही है. तो दैट्स वाई द होल पॉइंट वाज कि 2 साल की इंटर्नशिप अब सबको करनी पड़ रही है. और ये बेसिकली पूरा ना ये उसमें ला रहे हैं कि सारे FMGs को 2 years की इंटर्नशिप करना पड़े, उस टाइप की चीज़ चल रही है. और पे तो हम लोग ऐसा है कि हम मान के ही चलते हैं कि वी आर लाइक कि वी वोंट गेट पेड. इट्स जस्ट कि इंडियन डिग्री मिल जाए, अभी इंडियन मेडिकल लाइसेंस मिल जाए. दैट हैज़ बीन द मोस्ट इम्पॉर्टेंट थिंग फॉर अस FMGs. सो इसलिए वो कम पे में या नो पे में भी काम करने के लिए ऑलवेज रेडी है. सो यू टोल्ड मी अबाउट लाइक यू आर प्रिपेयरिंग फॉर 2 exams. सो विच ऑफ दोज 2 exams आर यू प्रिपेयरिंग फॉर? NEET PG and
No, I'm just preparing for I'm not preparing for NEET PG. I'm preparing for USMLE. So I've not given my step 1 yet. I'm going to give it in July most probably.
So tell me about why you planned basically for USMLE, क्योंकि I have seen a lot of this basic trend growing on with where Indian medical, even FMGs also are going a lot over USMLE and PLAB. So क्या reason है, आपका क्या reason है? क्योंकि I know it might be because of the toxic culture. I hope वही है, क्या reason है?
Exactly. ठीक, एकदम nice निशाना you have put. It is actually because of the toxic culture and all the ego issues that come in and the amount of scut work that we have to do. Actually I have no issues doing the scut work if I am learning something in return. ठीक है, मैं 4 बजे तक रुक जाऊंगा हॉस्पिटल में, कोई प्रॉब्लम नहीं है. कुछ सीखना भी चाहिए ना. So the culture around, you don't know this, so you must be bad or you must be doing something wrong. Instead of ठीक है इसको ये पता नहीं है तो कुछ सिखा देंगे इसको. Instead of that culture, that is the entire reason. And of course the compensation is a huge factor क्योंकि people there are paid more. And if you have to support a family, I come from a very middle class background.
Okay.
And I need to be able to support my parents in the future, which I think कि यहाँ पे रह के करने से I would not be able to support. That is my logic for going outside, trying to pursue that life.
Okay.
That
How
is
are
the
you
logic.
feeling in your friends, like बाकी सारे most of the students in your juniors of your college? How is the basic, like all of them?
बहुत सारे, in fact, many of my friends are going trying for USMLE. And majority of course are taking the NEET PG pathway. Majority, like a lot of my friends are trying for USMLE as well. Because the government itself is not supporting the new generation of doctors, right? You literally said अभी कि मतलब 2 साल का और internship करो, 1 साल you missed classes. It's like shortage है यहाँ पे. There is a shortage of doctors in India. But the government is turning a blind eye to it. No, we won't let new doctors also come. Let the people who are working now work their ass off and try to, come up for the shortage. I'm like, it doesn't make sense. It does not support new doctors, the system here. And NEET UG का भी, if you see the situation of NEET UG, did you see कि मतलब 600 marks you are getting, फिर भी 20,000 रैंक आ रहे हैं लोगों को. तो मतलब first of all, less number of seats, more competition. The government doesn't support new healthcare for the people. So if the government itself is not supporting, like how long can the doctors keep working and feeding the system? At one point, you have to think about you and yourself and your family as well, and not from a very selfish perspective. I think it's a very basic right to be able to look after your family.
बेसिकली मुझे ना आप ये बोले ना तो उससे मुझे सेम चीज़ यही याद आई कि लाइक आई हैव बीन टॉकिंग टू क्वाइट अ लॉट ऑफ डॉक्टर्स हु हैव लाइक एट द एंड ऑफ देयर प्रोफेशनल करियर्स, लाइक हु हैव ऑलरेडी स्पेंट 30-40 years, and one common thing they usually tell to me is that the thing which we like right now the Indian medical students are discussing about is quite different towards what we were at that point, because now it's much more about कि कौन सा एग्ज़ाम हमको क्लियर करना है, कि कौन सा पाथवे जाएंगे. इट्स नॉट मच मोर रिलेटेड टू कि पेशेंट सेंट्रिक कैसा होना चाहिए, पेशेंट को केयर क्या देंगे, या कौन सी हमने नई क्लिनिकल टेक्निक सीखी कंपेयर टू इट्स हैज जस्ट बीन कंसिडर्ड टुवर्ड्स कि इस पाथवे में जाएंगे, ये जॉब कर लेंगे, या नीट पीजी निकल जाएगा, ये एमडी मेडिसिन वो. सो व्हाट डू यू फील ऑफ दैट? लाइक
ट्रू
वैसा फीलिंग वहाँ इंडियन मेडिकल ग्रेजुएट्स में भी है, क्योंकि यार आई कैन टेल यू अबाउट FMGs. It's just limited to, most of the FMGs are all about just getting an Indian medical graduate degree. जैसे ही एक लाइसेंस मिल जाएगा, they would either go for a NEET PG, or some of them would not try. They would just get a government job, whatever the thing. But that's the whole mindset of they aren't really bothered about the patient.
That is a very excellent point that you have brought up. क्योंकि the thing is, जो पहले जमाने में था, like I was telling you the example of NEET UG, ठीक है? In 2017 when I had written NEET UG, I got 625 marks, ठीक है? And 625 में मेरे को आया था 1000 rank, 1050 rank आया था मेरे को. And now 625 will get you around 10,000, 12,000 rank. So basically what is happening is the competition is increasing, and the chances of being a doctor, being able to have that first priority as patient care, or first priority as skills that you want to learn, all of that is vanishing, because the competition is so much more tougher. It naturally shifts your attention there. कि मतलब अच्छा ठीक है, I'll go to the hospital today, I'll think about patient care, I'll think about their needs. Of course you need to, as a good doctor you have to focus on patient care and patient needs and all of that. You need to, absolutely. And that should be a number one priority. Being a doctor, like even if you forget about all of your exams, it's perfectly fine as long as you are patient centric. That needs to be the first scenario. But the thing is, how do you take care of someone else when you are not taken care of mentally and physically, and in terms of the ease of the system? Okay? If I'm in a system and I want to do good for the system, I should be taken care of, right?
Yeah.
नहीं तो see, if for example you have a person who is not at a good place, who is like depressed and all, okay, think of it like that, and उसका दोस्त भी, he is also not in a good place, he is also in a very negative state of mind or extremely depressed. So does that benefit either of them? Conversations between them, it wouldn't benefit, because both of them are at on the negative side of the spectrum. ठीक है? Is the same situation is happening here. ठीक है? Patient आ रहा है, patient has a lot of course when you are looking at the patient side of things, very easy to forget about them, really. जो system है यहाँ पे इंडिया पे, you are thinking of patients more like case sheets. ठीक है? You are taking a case sheet, writing down treatments, and you are thinking that अच्छा patient ठीक हो जाएगा ऐसे. तो मतलब at least you can't give the patient 15 मिनट 20 मिनट जो तुम दोगे. There is no system that allows that. कि अच्छा ठीक है, एक पेशेंट को देखूंगा 15 से 20 मिनट देख के I will try to better his life. Okay, there is no system that supports that kind of conversation or supports that kind of treatment. अब 5 मिनट में निकालूंगा, फ्री में सबका ट्रीटमेंट हो जाएगा. That is the mentality here. And this shift, ठीक है, this shift of more competition, more people falling sick in the first place. Okay, so the burden is more not only on the patient. Of course, the patient has the most amount of burden because their lives affect their families' lives and all of that. But for a doctor to be able to think about the patient and think about how much of his life is already a mess is just going up exponentially day by day. The system is making it harder and harder for us to concentrate on the fact that patient care is the first thing that we should focus on. And if you see जो subjects हम लोग को रहते हैं, is there a subject of patient care or encouraging healthy conversation or encouraging mental health? There is no subject that talks about it in the first place. Forget about the in-depth discussion. There should be some platform that talks about it. And if you look at the hospital setup इधर, ठीक है, you will notice that there is no HR. There is no HR. कि मतलब अच्छा, you are feeling a little off today. मैं जाके किससे बात करूँ? There should be some kind of a counselor, right? Schools में nowadays schools, the big schools that you have orchids and all, they have counselors. They have people taking care of the students that are housing them. But as a doctor, I am working in a toxic environment first of all. ठीक है? And who do I go and talk to? Is there an HR? कि अच्छा इसने मेरे साथ बदतमीजी की है. My colleague has done this. Who do I talk to? There is nobody. You just have to just get rubbed by the system, and it just brings you down mentally, emotionally, physically. It just brings you down. All of that. So coming back to the thing that the previous generation of doctors didn't have to face all of this. That is not true. They also had their own set of challenges. But the challenges today are different from the challenges back then. Back then there was not a lot of competition. They had a better. There were no competition amongst doctors themselves because log the na doctors, they wouldn't fight with each other. There was no ego issues. There was no competition in NEET, UG, PG because seats were limited. People who wanted to be doctors were also limited. Now the system is all effed up.
That's why I recommend.
It's just in a bad place.
If any of my junior asks कि if I have to give NEET UG, मैं ये बोलता हूँ भाई मत जाओ इस pathway में. Like right now, giving NEET UG in India doesn't even matter क्योंकि the competition is.
It doesn't make sense because most of सब लोग क्या सोचते हैं कि अच्छा डॉक्टर बनूंगा, थोड़ा रेस्पेक्ट आएगा, बहुत ज्यादा पैसे आएंगे and हो जाएगा, वो डॉक्टर बन जाएंगे, will be at a nice place. But it is not like that. If paisa is what you want, then you can easily become a software engineer. 4 साल के बाद you will get a 1 crore का package. Your life is set. You have kids. You have a family. It's all set in that way. So what happens is since nobody is there to counsel new kids, कि मतलब they can't imagine कि 10 साल बाद their priorities will be different. They will want to have a family. They'll want to have kids. They will want to have a balanced work-life situation, right? So nobody counsels them that way, and they end up here. I didn't know it is going to be this way. Nobody counseled
I
me.
also didn't knew because the initial motivation behind me taking biology and going through this pathway was I didn't like maths. अब maths मुझे पसंद नहीं है, then I can't go to commerce also. Obvious pathway, go to biology, okay. और उस समय like I didn't know about my interest. Okay, ये चीज़ मेरा interest है, so I should go to that pathway. I didn't know about that. I was given doctor and I became like I would be becoming in the 1 year. So I think this is the basic mindset of all Indian medical kids, like Indian kids also who are just giving NEET UG. सबको वही लगता है कि he can get the bare minimum in NEET UG to get a medical college, even a private one also. But the things are right now is like 20 lakhs this time gave na. So 20 lakhs can't be. And also आप पढ़ाते हो ना, like you have. So how has
I have been teaching
experiences?
NEET UG students.
How has been your experiences of
it's-
NEET UG teaching students?
In fact, it has been more fulfilling than just being a physician or just being a doctor. And all these years, ठीक है, it's something I really like to teach. I feel it's kind of a very noble profession, just like being a doctor is. Because if you ask me who taught me piano for the first time, I'll never forget his name. I'll never forget Martinson. So you become like an integral part of somebody else's life and achievements. कि मतलब वो बंदा कभी you will never forget your role because you had that long-term rapport with that person and he would come and teach that person every other day. And so that part of my life has been very fulfilling, not in terms of money, but in terms of um, yeah, the amount of fulfillment that it brings in terms of how much effect you're able to have on that person's life. So, and I always encourage anybody who is a medical student, like a good doctor is a good teacher.
Obviously.
And everywhere in your throughout your journey, you will be teaching your juniors. Like you're in final year, okay, you must be teaching your like second year, third year kids about when they are coming to the postings. कि मतलब अच्छा ये ऐसा होता है, ये ऐसा होता है. You know, so a good doctor should definitely be a good teacher, in my opinion, in the first place. And
now
yeah.
basically now that we are done with all of the things, एक last NNC के कारनामे के बारे में बात कर लेते हैं. What is the feeling about next exam? Next exam के बारे में.
Oh no.
क्योंकि probably
See,
अभी कुछ कल परसों ही नोटिस आया है कि इट्स प्रोबेबली गोना हैपन इन आवर ईयर. जब हम लोग लास्ट ईयर फाइनली क्लियर आउट कर लेंगे तो हमको देना ही पड़ेगा. सो व्हाट इज द फीलिंग इन इंडियन मेडिकल ग्रेजुएट्स? व्हाट आर दे थिंकिंग अबाउट इट?
Amongst my colleagues, all of them hate it because already एक system चल रहा था. You could have made that system a little bit better instead of changing the whole system in the first place. ठीक है, एक system चल रहा था, you are changing the whole system first of all, and that is a sort of infuriating thing for students.
Yeah.
Because वो लोग, there are so many students who have been preparing from the third year. मैं उतना फॉर्चुनेट नहीं था कि मतलब थर्ड ईयर से चलो नीट की पढ़ाई शुरू करेंगे, नहीं था. बट देयर आर लॉट ऑफ स्टूडेंट्स हु आर डूइंग दैट एंड इट इज वेरी अनफेयर to suddenly change. And not only that, there are people who have written NEET last year and were preparing for NEET in the next year. What about them? So there are a lot of hurdles to this next situation. The only thing that is good in my opinion is that questions मैंने सुना था कि more clinical based आएंगे. Because NEET के जो questions अभी आ रहे हैं, those are totally nonsensical. Those are like हाँ रट्टा मारो. That will not make you a better clinician. That will not make you a better doctor in any way. Of course, the next questionnaire will be better in terms of creating better doctors. But there is a lot of negativity surrounding it because people were already preparing for an exam and they have to give something else, you know. So that is the situation.
Similar is in the case of FMGs. We also think that probably because of the next our passing percentage हमारे गिरेंगे क्योंकि like if you have to clear 6 different papers in each of them, so it would be very hard for them because earlier it was like FMG exam still is without a negative marking exam, so you still can get through it by even like just guesswork also. But after this we don't think we would get through, but okay, like the person who have prepared for the exam, then he would obviously get through the exams. So that has been the thought about it.
So you will also need to write next exam.
Yeah.
Even FMGs have to write the next exam.
The whole premise of next exam is basically that to comprise FMG, NEET PG, all of that into one exam.
AIMS exam, वो सब मिला के exam. Okay.
So it's like it's also good for us because now we have to give only one exam, and we would probably, if we score good, then we would probably get a PG seat with that marks only. So they are kind of making it like a USMLE also with the step. Now that step 1 is just pass and fail, but step 2 के scores के हिसाब से आपको residency शायद मिल सकती है. So that kind of stuff they are coming up with. So let's see how that rolls out.
Since I'm preparing for USMLE, I don't have any issues with that. But that's a totally personal thing. A lot of my friends have issues with it, and it's troubling for a lot of students, even for you, because see, they're just putting hurdles one after the other. They are not taking burden away. They are there to just keep feeding you more burden. इसके बाद ये, इसके बाद वो, and to be honest, it just gets harder and harder down the line. So as long as you're a student, you should enjoy your college life to the fullest extent possible. Because इसके बाद things are very dark and very pessimistic. They are not turning out very good around here. So so that is the thing.
So
a huge change needs to come in the right way. Definitely next, I don't think is right according to a lot of people.
Like so, no one is gonna like even after this, no one is gonna like take medicine as a pathway, na, because NEET UG का हाल तो सबको पता ही है. And then when after next, and even आई कैन टेल यू अबाउट FMG पाथवे। ये वाला पाथवे इन्होंने ऐसे रूल्स के साथ इतने अच्छे से रूइन किया है कि कोई भी एक बार FMG वो चूज़ कर ले अपने आप को बनाना या कोई भी यूनिवर्सिटी में जाके एडमिशन ले ले, देन आफ्टर ही कांट कम बैक टू इंडिया बिकॉज ऑफ द रूल्स दैट दे हैव मेड। So one of the rules out of which is you have to get you have to get a medical license in the country in which you are studying, and getting a license in a country is very hard क्योंकि let's suppose मैं अभी यूक्रेन में हूँ, so यहाँ पे मुझे यूक्रेनियन अच्छे से बोलना आना चाहिए। मेन एग्जाम इज द लैंग्वेज एग्जाम दैट यू हैव टू क्लियर, एंड इट्स वेरी हार्ड फॉर ईच ऑफ द कंट्रीज। So basically they had made it very impossible for like students to go through that pathway. The only thing is left is either choose private college or just try another time. That's what they are trying to do.
Hmm.
So I guess
The thing is there,
yeah,
there's so much of shortage इधर doctors का, and this will only create more shortages. This will not help the situation in India, for sure.
but they say कि इससे quality of doctors अच्छी होगी।
देखेंगे ना, the 10 years down the line you will be able to see quality अच्छी हुई या गंदी हुई।
वो तो बात है।
See, doctors का quality depends on the individual be trying to be a doctor. It is very much individualistic, क्योंकि पढ़ाते ये लोग कुछ भी नहीं है, हमें खुद ब खुद ही पढ़ना पड़ता है। सिखाते हैं, थोड़े सीनियर सिखाते हैं, but you should have the curiosity yourself to learn and want to do better. So let's see what happens. 10 years down the line we'll have this conversation again, hopefully.
True.